Hey everyone, in this video we're going to talk about endocrine disorders. So what I want to do is go through some of the dysfunctions, or if you'd like, pathophysiology, that describe situations in which the endocrine system sends the wrong signal or sends too much of a signal and therefore throws off the body's ability to maintain homeostasis. Let's begin with actually hypo or hyperthyroidism. Now you can imagine what these two things mean. Hyperthyroidism means that the thyroid is sending out too much of a signal, which means the machinery of all your cells in your organs and your tissues are just operating too aggressively. Hypothyroidism means that machinery is not operating aggressively enough. One interesting factor in the function of the thyroid is that it absolutely needs iodine. Now here is, for example, a molecule of one of the signaling catalysts, the hormones, that is produced by the thyroid. And you can see there all those little I's, that's iodine. Without iodine, it can't produce those hormones. The reason this is interesting is because in American history, it used to be the case that thyroid disorders were much more common. And the way we solved it is we started adding iodine to salt. So if you notice now, when you buy table salt, it will say ionized salt, iodinized salt. And what they mean by that is that they've added iodine to it. Sea salt naturally has some iodine in it, but salt that is mined from terrestrial mines doesn't have that iodine in it. And so we started adding the iodine to it, and in that way have significantly reduced the cases of thyroid disorder. So let's talk a little about what thyroid disorder look like. Okay, first off, one possibility is when your iodine is low, you're going to produce a lot of thyroid stimulating hormone, but your thyroid's going to be unable to respond with the appropriate level of thyroid hormone. And the result is that the TSH, the thyroid stimulating hormone, is going to cause an accumulation of what's called thyroglobulin. You remember what globulin is, right? All collected together. So that thyroid globulin is going to create a mass in your thyroid. And you're going to keep getting this TSH signal because your body is going to identify a low level of thyroid hormones. And so therefore, your anterior pituitary is going to send a signal, that's the TSH, saying produce more, produce more, produce more, and your thyroid's not going to respond. So that is all going to basically create a mass. And we call that mass, that lump that forms, a goiter. And these used to be more common than they are now, but here's an image of one. And you can see from that it's sort of a large mass right around the thyroid. That's the result of that thyroglobulin building up. Clearly, that's not a desirable thing, but I will bet that none of you have ever seen that in a person. Having said that, if you had grown up a few generations ago, you would probably know exactly what I'm talking about because you would have an uncle, an aunt, or know a storekeeper or somebody else who has a pretty significant goiter. That has really gone away in the United States by and large. It's not completely gone, but it's less common in the United States. But around the world, there are countries in which that's not that uncommon, in particular landlocked countries. And the reason for that is that iodine is present in seafood, in shrimp, in other fish, etc. And so countries that live near the shore, much of the population has some access to iodine. But a landlocked country that doesn't eat a lot of seafood might experience a significant reduction in iodine in their daily diet. And the result of that would be this kind of hypothyroidism. That is, the thyroid is not sending out the appropriate signals, the hormones, to the rest of the body, even though it's receiving the TSH from the anterior pituitary. It's not sending out the signal. It's unable to respond to that signal because it doesn't have the iodine it needs to make the hormone. Okay, so another possibility, now that we've talked about how things can be too low, is hyperthyroidism. Well, before I get to hyperthyroidism, I should sort of lay out that it's not just goiters. So really quickly, in addition to goiters, some of the effects you're going to get might be, for example, weight gain because your machinery is slowed down, right? So you're not burning as many calories. Maybe cold extremities, so your hands and your feet might be somewhat cold, again, because the cellular machinery is not moving as aggressively. Constipation is not an unusual symptom. Why? Because again, constipation requires that the smooth muscle move that stool through your gastrointestinal system. And if everything's slowed down, if all your cellular machinery is slowed down, then that's not happening adequately and you're going to get stopped up. So there's different problems. If you have congenital hypothyroidism, that is to say, there's something inherent in your makeup that causes your thyroid to not produce adequately, then you might see some more significant features as well. For example, small stature. You might have people that are relatively small. That makes sense, right? Because again, their machinery isn't developing at full strength. Where would you get that? Well, you might inherit that, but more likely is your mother actually suffered from a iodine deficiency, and as a result of that, you developed with hypothyroidism. So in severe cases, certain organs don't function or don't develop properly. Deafness is not an uncommon symptom. Muteness is not an uncommon symptom, and other kinds of problems. But basically, these are the results of early development because of hypothyroidism. And again, because I kind of can't stop myself from talking about it, I want to give you one more example that's super interesting. Hashimoto's disease. Hashimoto's disease is also hypothyroidism. So as you'd expect, it has some of those same symptoms of basically slow cellular machinery. However, in this case, it originates from your immune system. So this is actually immunoglobulins or antibodies that are attaching to your thyroid cells and basically inhibiting your thyroid cells from functioning. They are identifying your thyroid cells in the same way they would identify a bacteria, a virus, or some other foreign body. And therefore, you know what happens. Your thyroid cell is not functioning properly as the result of an autoimmune disorder. Your defensive systems are wrongly identifying non-problematic cells as problematic cells. This is kind of interesting, right? Your immune system wrongly enlists defensive cells. So it's not just these immunoglobulins, but they will also enlist complement and other factors to basically work against your thyroid. Your thyroid, therefore, doesn't produce adequate signals, and the result of that is fatigue, weight gain, constipation, maybe a resulting goiter. All the kinds of things we talked about. Okay, now the opposite is hyperthyroidism. And hyperthyroidism, of course, is that the thyroid is sending out too many signals, too much signal, and that is causing overactive cellular metabolism, really high metabolism. If I allowed you to guess, you'd probably come up with some of the symptoms of this, right? Weight loss, maybe hand tremors, maybe a rapid heart rate, profuse sweating, what we call diaphoresis. Basically, your body's overheating. Your cellular activity is too hot. You're creating more heat. Your body is sweating to try to keep your overall body temperature within a normal range. You might have very frequent bowel movements. You might poop many times a day. Why? Because your gastrointestinal system is moving too fast. Everything is just moving too actively, and so it becomes a problem. One of the sources of this can be a tumor in your pituitary gland. That is to say, you've got a tumor or a thyroid tumor, but a pituitary tumor or a thyroid tumor that basically is causing this dysfunction. And that might be the result, by the way, of too much iodine, which is crazy because I just described to you what can happen if you have too little iodine. It turns out that too much iodine could actually create excessive hormonal generation from your thyroid and therefore hyperthyroidism as well. So that can be a problem. And as you might imagine, if you had this condition, your physician would encourage you strongly to avoid things like caffeine, because caffeine also speeds up your metabolism, right? So the last thing you need when you are ready at a baseline level, have hand tremors and weight loss and overexcitation and too frequent bowel movements, is to start drinking caffeine and amp it up another 30%. So you can easily imagine why stimulants like that would be a bad idea if you had hyperthyroidism. Okay, a related disease, and this is kind of the mirror image of Hashimoto's disease, is Graves' disease. Graves' disease is really interesting because what it is here is it's antibodies that actually, again, misidentify your thyroid cells, but in this case, attach themselves to the follicle cells of your thyroid gland and cause excess release of thyroid hormones. So now we've got hyperthyroidism that's the result of an autoimmune disorder. This is really crazy, right? So in this case, your body's own defense systems misidentify some of your own cells as not self, attach to them. This stimulates these cells and they overproduce, overreact, and the effect, therefore, is hyperthyroidism. Your whole body's metabolism speeds up and you get all the symptoms you'd expect of that kind of condition, right? Same thing, the rapid heart rate, et cetera, et cetera. So this is kind of a really interesting disorder, and it makes me wonder, and I think it's made other researchers wonder, sort of how many times this happens. That is to say, how many times we identify some disease or dysfunction as being one kind of characteristic and don't fully appreciate the way something like an autoimmune disorder might play into it. Because the reality is, the recognition of Graves' disease being an autoimmune disorder has not been universal. We came to that determination with some research. And who knows, it may be that in the future we'll find that other diseases that we now don't identify as having an autoimmune origin actually, in part or in whole, result from autoimmune dysfunction. Okay, so what are some of the symptoms of Graves' disease? Well, here's an image from an archive of somebody who suffered from Graves' disease. Now, some of this you would already expect. So this woman probably had a feeling of nervousness and anxiety, irritability, maybe slight tremors in their hands or fingers, maybe inability to keep on weight, so they ate food, but they still burned a lot of calories, so they lost weight. All of these, frequent bowel movement, everything we talked about, but also one other thing, and that's why I flashed up this image so you can see it, those bulbous eyes. And the bulbous eyes are basically because Graves' disease attacks your tissue, in a particular vulnerable tissue, like the muscles around your eyes. And the result of that autoimmune dysfunction, is that tissue becomes inflamed as a result of the inflammatory response to this autoimmune dysfunction. And that leads to sort of the swelling that looks like crazy bulbous eyes. So in fact, this has at times been called thyroid eye disease, and at times called Graves' ophthalmopathy. Sorry, I had to think about that. But basically what that means is that one of the most notable features of this back in history was those kind of bulbous sticking out eyes that you can see in this person is pretty notable. And that's Graves' disease. Okay. The thyroid isn't the only one that can send out the wrong signals or get the wrong signals, right? Another possible type of disorder is a disorder in the adrenal glands. We could put out too much or too little. So, Cushing's disease is a nice example of this. Cushing's disease is the hypersecretion of cortisol. So the cortisol, remember we mentioned this before, but I'll remind you, cortisol is a stress hormone. So cortisol is the hormone that is released when your body is under stress and needs to prepare for maybe significant physical exertion or significant physical stress. This is developed through evolution, and it's fantastic, right? Because when you're in stress, this is going to help you address the threat. But when you are not in a position of threat, this could be very problematic. So in this case, Cushing's disease is when that stress hormone is present all the time. And the effect of that is, among other things, high glucose levels. You might say, why is that? Well, because your body is responding to stress. And one of the things it would do to respond to stress is make sure you have plenty of available energy to your cells. So your glucose levels are going to go up. And other things are going to happen too. Like, let's say, I don't know, flush face, easy bruising, weight gain. Here's an image that's not that flattering, but it kind of incorporates a lot of these features together. That round moon face, the addition of a lot of fatty tissue, muscle weakness, severe fatigue. Let's see, I'm trying to think of others. Slowed healing is one. Thin skin is a key one. And you might say, wait a minute, Hase, why is this preparing somebody for stress? That's just it. It's not. The hormone is supposed to prepare you to deal with stress. But if your body is constantly responding as though it's under stress, it's not going to rebuild the normal tissue that's necessary for a healthy body. So for example, if you are running from a saber-toothed tiger, you're not too worried about having healthy skin. And as a result of that, that stress hormone is not going to prioritize rebuilding dermal tissue. And so your skin is going to get thinner. You can see here that a lot of normal rebuilding that allows you to have a healthy body doesn't happen when you're continuously responding as though you're under severe physical or emotional stress. So that kind of stress hormone all the time, not good. Long-term exposure could lead to heart attack, stroke, negative effects on just about every one of your body's systems. So you can imagine this being a constant problem, right? Here's a disturbing image of a baby that was born with Cushing syndrome, and you can see that there's, the baby basically has a round face. Typically there's some acne, maybe obesity, poor muscle tone. You can see that this baby isn't looking terribly healthy. Here's another image, and this one's somewhat disturbing. This is somebody with the same disease, Cushing's disease, and in this case, what's happening is they're putting on fat rapidly. They're gaining weight around their abdomen rapidly, which is one of the symptoms of Cushing disease, and the skin is thinning, which means you get these really significant stretch marks. Basically, the body is expanding faster than the skin can keep up. And you do get some stretch marks with, let's say, pregnancy or maybe other forms of rapid weight gain. Maybe men that are on steroids to grow muscles are going to have stretch marks around their biceps and other muscles that might just be growing faster than the body can accommodate. And if you are on a synthetic steroid, you also are going to suffer thin skin as a result of that, because again, this is a stress hormone. Your body's not going to balance things out properly. So this is a more severe case of this. This is somebody with Cushing's disease that's really got, significant striations there in their abdomen as the result of growing too fast and basically tearing apart the skin tissue. This is also a warning for those of you that are thinking, maybe steroids are a good way for me to put on bulk and put on muscle. You are forcing your body in a continuous condition of dealing with stress. And the result of that long term is not going to be good for you. Another interesting possibility, because we've talked about basically hypersecretion, is hyposecretion. And the term for that is Addison's disease. So Addison's disease is the hyposecretion of a corticosteroid, as I just mentioned. Now this one is a little bit trickier than hypersecretion because these symptoms and signs don't come on quite as aggressively. So it's not uncommon for somebody with Addison's to actually suffer for a considerable amount of time, maybe years, before they reach a proper diagnosis, because the diagnosis is not that easy. In other words, the symptoms are going to be things like maybe fatigue, maybe in a child failure to thrive or failure to grow as normal, maybe just general weakness, maybe some abdominal pain, maybe weight loss, maybe regular nausea, because it's going to affect your gastrointestinal system. But none of those things are going to raise for a physician or a patient a huge red flag saying, hey, maybe you don't have enough corticosteroids. So Generally, a lot of other diagnoses are put into the differential, as we say, before the physician comes up with a reasonable idea that it might be hyposecretion or reduced secretion of necessary steroids. The treatment for this you can easily imagine. It's basically supplement with steroids. So basically the idea here is to give the patient the steroids they need. But that's not as easy as it sounds. It's easier said than done because you got to get the level right. If you give them too much, then you could suppress their immune system too significantly and create other problems, because you could create basically a hyper effect. Or if you give them too little, you don't solve the problem. Famously, by the way, John F. Kennedy suffered from this disease. And when he was a child, he was sort of considered sickly, and compared to his brothers, he was considered less robust and less athletically capable. However, it turned out he was a badass and actually was a military and naval officer during World War II and did phenomenal things that won him righteously some significant medals, and then became president of the United States. So you can absolutely live a normal life with Addison's disease, but treatment in order to get your corticosteroid level where it needs to be will help you overcome things like the chronic fatigue and other issues that might result from this. Here's an interesting dynamic having to do with Addison's disease, which is really peculiar. That is to say, the ACTH, that is the adrenocorticotropic hormone that your anterior pituitary, near your brain, releases to signal that you need more cortisol, that hormone is actually also connected with the production of melanin in your body. And you remember that melanin is the thing that allows your body to have color. So if you have more melanin, you tend to have darker skin. If you have less melanin, you tend to have lighter skin, right? That's produced in the integumentary system, the skin system that surrounds your body. So if you've got somebody who has Addison's and is not producing enough steroids, the pituitary could still be producing ACTH, which means you get a hyper generation of melanin. Take a look at this image. This is a man who got Addison's disease. It became symptomatic and significant, and you can see the major change in his skin pigmentation. That's because even though he wasn't adequately secreting steroidal hormones, his pituitary was still secreting ACTH, and that ACTH darkened his skin. And you can see there, it's a pretty significant change. I mentioned earlier that it's tricky to deal with this because you've got to give the patient some steroids to replace the steroids their body otherwise would have produced. And you got to get that level right. And often that can take a lot of adjustment, and it may actually change through the life of the patient as well, and depending on the environmental conditions of the patient. So there's some fair adjustment there. In this case, though, if you get it right, that is a really good option for the wellness of the patient. The point I want to make now is that we use steroids a lot in treatment of other issues, and they work very well, but they can create some problems as well. That is to say, think about cortisone. Maybe some of you at some point have taken a cortisone injection. Maybe, I don't know, if you are an athlete, you've had a cortisone injection in a knee or an elbow or some other joint. What's it there to do? It's there to promote healing, and that makes sense, right? It's a stress hormone, and it's going to promote healing, and most particularly, it's an anti-inflammatory. That is to say, inflammation is about the healing process. Cortisone is about the immediacy of the situation. So cortisone will actually reduce the inflammatory response. Now that can actually potentially promote some healing. By reducing excess inflammation in a joint, you can actually allow the joint to heal. So a cortisone injection might make sense in a joint to allow it to heal. Having said that, Cortisone injections are frequently somewhat temporary, so they produce relief, but they produce relief for months or maybe years, but perhaps not permanent repair. Prednisone could be used, and this, if you had Addison's disease, is probably the medication you'd end up taking, prednisone. But you might have taken prednisone some point in your life when you had an illness or an injury, and the physician gave you prednisone, or what's commonly called pred, basically as an anti-inflammatory. And if you had some kind of condition that allowed you to be, or caused you to be particularly sensitive or susceptible to inflammation, you might take prednisone fairly regularly to avoid that. Steroid-based inhalers. If you've got asthma, we talked about that. You might have an inhaler that is a steroid. Remember, we talked about that because it's going to create that fight or flight response, and that is going to open up your airways, and that can solve a problem like anaphylaxis or asthma or something like that. But if you take that regularly, that is also a steroid. Hydrocortisone cream. You probably have some of this in your cabinet, and maybe if you get a rash from some kind of bug bite or, I don't know, some kind of inflammation in your skin, you will rub a little hydrocortisone cream on it to solve it. That can work very, very well because it's going to work against the inflammatory response. So that makes sense. It's an excess inflammatory response that's causing that rash. So calming that inflammatory response down will help solve that. Here's the problem. Each of these can make you somewhat susceptible because they are anti-inflammatories, and so they are dialing back your body's defensive process. We call that downregulation. So in the endocrine system, downregulation basically means this. You've got receptors there, right? So you've got a hormone that goes around your circulation, finds a target, and says, this is the thing I am meant to connect with. But if that receptor receives too much triggering, it'll slow down and it'll shut down some of its receptive capacity. It's going to inhibit some of its reflective capacity. So some of those target cells, that's a term we used before, basically are going to decrease, reduce their numbers and reduce their sensitivity. And that could potentially lead to a problem. One that comes to mind is with diabetes. You know, remember I mentioned diabetes earlier, and we're going to have the next video talking about diabetes. But if you eat a lot of sugars, your receptors are going to sense that sugar, are going to send a signal to the pancreas saying, release insulin. And that insulin is going to go around your body and allow your cells to absorb the sugar. But if you eat a lot of sugar, at an extreme, if you start that chocolate cake diet, you're going to lose weight on that chocolate cake diet. Chocolate cake 24 hours a day, can't be wrong, right? What will happen is you will overwork these receptors and you will experience downregulation. Your body will shut down some of those receptors and reduce their numbers. And in response, you will be less able to deal with that high glucose level. We call that type 2 diabetes, or a form of type 2 diabetes, where basically your body develops a resistance to insulin or a declined capacity to produce insulin. We'll talk about that more in the next video. Before I wrap up this video, I want to mention one more thing because you've probably heard of it, which is that certain plastics have been shown conclusively to produce chemicals that mimic endocrine signals and disturb endocrine processes. So BPA, for example, is a chemical that will leach out of plastics, in particular things like plastic water bottles, and can actually interfere with the normal function of your endocrine system. A lot of these are chemicals that aren't inherent to the plastic, but they're plasticizers and other chemicals we put in the plastics to allow them to have certain characteristics to them. But let me focus briefly, just for your health and safety, on water bottles. If you are using a lot of single-use disposable water bottles, you don't want to reuse those. And you don't want to leave those out in the sun. And frankly, you probably just want to buy yourself a reusable water bottle and use that instead. The filtered water, in our case at Stockton University on campus, is absolutely safe and well filtered because those bottles are leaching synthetic chemical disruptors of your endocrine system into the water, and you're drinking that. Not very much, but if you're drinking that water regularly, that's going to have an effect. And if you leave your water bottle, let's say, in the trunk of your car for several months, or in your car where it gets hot, or in the sun, or in a boat, or, I don't know, on the side of the track when you're doing, workouts or whatnot, then it's going to leach even more. And so these endocrine disruptors can be pretty significant. And there's a fair number of them in modern society, unfortunately. So you want to be aware of that, and you want to avoid exposure to too many disposable plastics, particularly in water bottles, and particularly reusing them. So if you do have if you are going to use disposable water bottles, okay, I advise against it, but if you're going to do it, go ahead and do it. But if you do it, don't reuse them. Don't refill those water bottles. That's not what the plastic's meant for. That's not what it's designed for, and it's not safe for that. Okay, I will see you in the next video, which should be relatively short because we're just going to focus on unpacking this idea of diabetes as the last bit of our discussion in endocrine pathologies. See you then.